Coronaviruses are a family of viruses to which this new virus from China belongs to and is related to other viruses that people may have heard about, SARS back in 2002 and 2003, and in the past decade, MERS. There are 7 coronaviruses overall that cause infection in humans that we know about, and some of them cause more severe cases of respiratory disease, and this one in particular mimics and mirrors what we've seen with SARS in causing a severe pneumonia in a proportion of individuals.
Is quarantining or walling off from travel cities, whole cities, an effective way to contain the virus?
I think it's important to understand that quarantine is just one tool that we have in a whole toolbox of public health measures to be able to control outbreaks. Quarantine can be effective, but can't be effective on its own, especially when a disease is transmitted between humans and has already spread. We need to also include case finding, contact tracing, good screening, as well as education of the public and our primary healthcare providers.
Doctor, it's Meg Terrell. I don't know how much you were able to listen to the Emergency Committee webcast just now from the WHO, but the committee was asked several times about the actions in China, and they seemed reluctant to really address whether those actions were good or bad. But there is a lot of speculation here in the United States about whether China is being extremely upfront about the case counts and everything else that's going on. Dr. Scott Gottlieb, in an op-ed in the Washington Post, said it's great they provided the genetic sequence so quickly, but they haven't provided samples, for example, of the virus. What is your expectation of how much information we are getting from China and how much information or how much that information can be trusted?
I think if you compare to the outbreaks in the past, and particularly SARS, which people may not know was actually the reason why this mechanism of public health emergency of international concern was created by the WHO, the information that has been coming out from public health authorities from the epicenter of the outbreak and beyond has been really transparent and been very responsive. With respect to the data that's been coming out, there's been a lot of open sharing of information between public health professionals and scientists. And regarding samples, that requires the consent of the individuals who are infected, so it may take longer for some of those samples to be shared among the scientific community.
Would you expect this virus to spread to the United States and elsewhere in the West? And if so, how broadly and how quickly? And then following on that, if it does spread to the United States or elsewhere in the West, Canada or Europe, would you expect the mortality rates to track roughly what they've been in China?
I think the key point here is that it's so early. This virus was only identified and isolated 3 weeks ago, which is actually a good sign that we've been moving so quickly. We have the technologies that we didn't have back when SARS caused an epidemic. So it's very hard to know what the ultimate mortality is going to be. The mortality right now is about 5% compared to what was seen for SARS, about 10%, and then MERS, the Middle East Respiratory Syndrome, that causes about 35% mortality. As we see more cases, and I expect that we will see more cases, not just in China, but in other countries as well, those estimates of those mortality rates will be adjusted. As far as the transmission in the U.S., well, we've seen a case in the U.S., a confirmed case. The good thing is that we have a very coordinated and very rapid interagency response among the U.S. government, of which my agency is part of, and there's been a very quick and aggressive approach towards implementing countermeasures and public health tracking mechanisms.
Just very quickly, Doctor, do you agree with the WHO that this is not yet an international health emergency at this point?
I think it's prudent and wise for them to make sure they have all the data they need. There's a number of criteria that need to be met before they can make that declaration.